Welcome, everybody. I would like to introduce you to our three speakers, Dr. Noémie Dahan-Oliel, Luca Paciueli, and Dr. Craig Campbell, and they will introduce themselves during the presentation. If you have any question, please, you can put it in the chat, and we'll do the questions at the end. You can ask questions either in English or in French. Thank you.
Thanks, Mary. It's really wonderful to be back here doing a webinar as part of the Muscular Dystrophy Canada webinar series. Hope everyone can hear me okay. I'm here with I've done a number of these webinars as those who are part of the MDC community will probably know, but I'm really fortunate to bring two incredible colleagues with me tonight, and they're going to introduce themselves in a minute. What I would do is just point you to our affiliations and partnerships here on the front slide. And of course, many of you will probably know about McGill and Western, but take a peek at Ill Abilities because it's an incredible website and yeah, well worth the stop on that one. The other thing I wanted to just mention before we dive into our seminar tonight, which is working together to build e-learning in rare neuromuscular diseases, lessons from arthrogryposis, is this project really represents a part of a unique partnership that's now a couple of years old between Shriners Hospital for Children Canada in Montreal and the Children's Hospital at London Health Science Centre here in London. We're very fortunate to have developed a fulsome partnership between the two organizations that has components of research, education, and clinical. And I can tell you, it's for me working, for so many years in the neuromuscular space, this has opened up a whole set of really valuable new collaborations. And this is just one of them, and connections with new colleagues and new way of thinking about things. I hope this you'll see through tonight, the value of always opening up to new collaborations and new partnerships. So I did want to just celebrate that a little bit. So I will now turn to my colleagues for a little bit of a self-introduction. Luca, do you want to start us off?
Awesome. Thank you so much, Craig. Much appreciated. Bonjour tout le monde. My name is Luca. I also go by Lazy Legs. I'm a professional dancer, motivational entertainer, and dance educator. I've actually had the privilege to work a lot with the NDC community early in the mid 2000s. I think we can say that in 2009 up until I think 2016. I was an ambassador for Muscular Dystrophy Canada, and I toured around Canada doing a lot of the youth in action programs and taught various dance programs. And It was through the partnership that I had with MDC that I learned that MDC actually, or that arthrogryposis falls under the umbrella of MDC. And that's why I'm very passionate to be here and speak on our project, to share a little bit more of what it is that we are doing. As a person with a disability and also as a parent of a child with a disability, understanding some of the frustrations and struggles that we can go through when we are dealing with clinicians. And through this project, we're really hoping to be able to improve communication on all fronts on end. So we're looking forward to present, and I'd like to pass the mic on to the person who helped spearhead this project, and I'd say is definitely the heart of this project. So Dr. Naomi, could you please introduce yourself?
Please let me know if you see the slides.
Yeah, perfect.
Okay, perfect. Thank you. So it's really a great pleasure to present alongside two wonderful colleagues, so Luca and Craig. And I am an associate professor at McGill University and a clinician scientist at Shriners Hospitals for Children. And we are presenting on behalf of a quite large team composed of clinicians, people with lived experience, trainees, and researchers. And we will be talking about our team in a few slides, so you'll have a chance to meet them through this presentation.
And my name's Craig Campbell. I'm a neuromuscular neurologist here at the Children's Hospital in London and Western. And again, thrilled to be here as part of the partnership. Thanks. So you can head to the next slide there, Naomi. Thanks. So we have a number of learning outcomes for the session. By the end of this, we hope that you'll feel comfortable to describe some of the key principles of co-development, explain the value of multidisciplinary teams, identify stages of e-learning development, and finally apply co-development and knowledge mobilization into practice.
And so first off, we wanted to start with a brief overview of what arthrogryposis is. So we often use the term arthrogryposis multiplex congenita, or AMC for short. And as you can see in these images, we can see children with spinal involvement of scoliosis of varying degrees and contractures at the wrists, the elbows, the hips. It can also affect the knees. So basically, what arthrogryposis means is really being born with contractures to more than two different body parts. And this, what I'm showing on the left side of the screen, is a definition that we work together with a team, again, of composed of people with lived experience and clinicians from many different parts of the world to come really to this consensus on what arthrogryposis is. And really, the key words to remember are contractures to many different body parts, which can also cause muscle weakness. And so you can imagine difficulties in doing different tasks of daily life, such as feeding, dressing, doing different activities such as sports. So this is what arthrogryposis is overall. Arthrogryposis is a group of rare conditions, so it affects 1 in 3,000 to 5,200 live births. And really, what is important to remember is that rare conditions like arthrogryposis, they present unique challenges, especially when it comes to accessing knowledge. So families often become key knowledge holders. They have this tremendous knowledge, as Luca just told us before, as well as people who have arthrogryposis. However, this expertise is not always integrated into formal education. And at the same time, in rare conditions like arthrogryposis, clinical practices can vary widely. So, this really creates an amazing opportunity to work together and to rethink how we can develop and share knowledge as a team. And so, where our journey began for this project is really initially when people have told us that there was this need for doing better in terms of rehabilitation and knowing what should we do in rehab. So there was really a need for recommendations for rehabilitation that was identified by clinicians. So that is step number one that you see on the far left. What we proceeded then is to co-develop rehabilitation recommendations with an international team comprised of clinicians, researchers, and people with lived experience. And after that, we realized that even though we co developed these rehab recommendations, how do we really share them? How do we make people aware of them and utilize them in practice? So, this is where this current project really comes to life. And so, we were funded through the National Network for Musculoskeletal Rehab Research. It's a Canadian network, and they funded us for this wonderful team, which we'll tell you all about, to co develop strategies to share this knowledge. So, this is really what our journey is about. And so, now we're going to walk you through each of these steps. So, first of all, the need for rehabilitation recommendations came from the fact that throughout their career, occupational therapists, physical therapists, and any other healthcare provider actually may encounter only a few individuals with arthrogryposis, and these individuals may also differ significantly in terms of how they present and their needs. So, our preliminary work showed that there was really a need to develop these rehab recommendations. And so, through different activities, we actually identified uh, areas to target. So, this was done with youth with arthrogryposis, caregivers, and clinicians. And we actually started this work back at one of the AMCSI days. So each year, the largest support group for arthrogryposis holds a family event, usually in July, around the July 4th weekend. And this was done in Vegas, where we asked people what is important to them. And these six priorities were identified. So people really told us that they want more information and knowledge and guidance on muscle and joint function, pain, mobility, self care, participation, and psychosocial well being. So, what we did next is that we utilized an we did a series of different scoping reviews to better understand what we knew from the literature on each of those priorities. And then we also did an international survey to try and understand what are clinicians currently using in terms of assessments and management. So this work really started back in 2017, and each year we added a new part. So this is really the diagram that shows all those different phases as to how we develop those recommendations. So we really, again, started with the identification of the problem and then looking in the literature for what is known. And we published a series of those scoping reviews with patient partners as well. We did the clinician survey. And then we proceeded to using the GREAT framework, which is really the best practice for developing recommendations and guidelines, to proceed with developing a set of recommendations. After that, we did a Delphi process with a larger group of experts worldwide to really get consensus on these recommendations. We then had a panel of external experts who did not partake in any of these phases to appraise our process and the final product. And then we refined the recommendations using their feedback. And at the end, we also wanted to identify what are things that make it easy or hard to really promote the uptake of these recommendations in practice. And this is where we are now to really co develop knowledge mobilization strategies together as a team. So at the end, what we have through this project of the development of these recommendations are 16 recommendations in 8 priority areas. So you can see that these areas really focus on what the people with lived experience and the clinicians shared with us. So they really target early intervention and motor development, muscle and joint function, orthotics, mobility, participation in areas of life, pain, psychosocial well-being, and perioperative rehab. And again, to remember that we co-developed all of these recommendations with teams of clinicians as well as people with lived experience. And we published this work last year. And we also have a guide that we're just currently refining, but we will then be open to everyone. And so our next part is about the co-development of the knowledge mobilization strategies. So there's really a large gap between research and practice. And what the literature tells us is that many findings never reach clinical care. And there's an average of 10 years delay between finding out evidence and actually implementing that. So putting that into practice. We do know that knowledge mobilization, so this idea of using knowledge and sharing it in ways that people can relate to, that is relevant and meaningful for them, really improves decision making and the quality of care. It also promotes collaboration, like we'll show you throughout our presentation today, and the relevance, the meaningfulness of what we do. And ultimately, it can lead to better patient and system outcomes. So, really, the message here is that by co developing these knowledge mobilization strategies, and we'll show you today a series of several different strategies, it can improve not only the creation of knowledge, but also the use of that knowledge in practice.
Thank you so much, Naomi. Um, just warning you all, my daughter is having a little bit of a freak out upstairs. So if I'm a little distracted, it's just because I'm hearing her screaming at all. But talking about that, actually, I think what's important is just knowing that we are building a team that is um, that that essentially everyone's voice is being heard throughout this team that we're building. Essentially, we want to ensure that people with lived experiences are part of this team. I don't know if you're all familiar with the phrase "nothing about us without us," and I think that that's what's really important is because people with lived experience do have firsthand knowledge compared to what the textbooks might say. There is every single body, every single person um, reacts differently to some type of, um, I would say, um, I'm in a loss of words right now. Sorry about that. But basically, every single person reacts differently to what recommendations might be given. And at the end of the day, the person with that disability might have other recommendations to be able to share with your clinician or your researcher or your trainees. So essentially, we're very fortunate to have people on our team that actually have dual expertise. So, such as a researcher and a clinician, and they are both together. Like so, I'm gonna butcher the names, so I'm just gonna say their first names. But we got Betty, who is a researcher and a clinician. Craig, who is a researcher and a clinician. Francis, who's an individual with arthrogryposis and also a clinician as well. Lizelle, who's a caregiver and a clinician. Carolina, who's an individual with this arthrogryposis, and she does patient support, as well as Ani, who's a mother of a child with arthrogryposis, and she does patient support, as well as the founder of the AMC Support SI group. And myself, currently, I am on this team as well too, as an individual with this arthrogryposis, and I have my 6-year-old daughter Luna, who has arthrogryposis. So essentially, our goal as this team is to really just share our strategies, to be able to mobilize our knowledge together. The word co-development, what is it? I have to be honest, I didn't know what it was until I was a part of this project. So essentially, co-development is a broad group of people coming together and building this relationship to create more knowledge to be shared across all borders. For this specific project, again, it includes people with arthrogryposis, the families, clinicians across many disciplines, researchers, and organizations. It also brings different perspectives, but can complement each other. And also, it might not necessarily complement each other, but we're going to be able to learn something completely new and again be able to use that later on. And I would also like to just reemphasize the importance of having people with lived experience within this development because essentially, when we're talking about arthrogryposis, the research is still very rare. Arthrogryposis in the 1980s, there wasn't much knowledge about arthrogryposis. Actually, I was treated as if I had spina bifida. And so for a long time, a lot of the surgeries that I was having was more trial and error and just seeing what worked and what didn't work. And now we're about 40 years later, and the research, more and more research is starting to get developed. If we're talking about adults with disabilities, adults with arthrogryposis, I mean, um, there aren't that many that are active that are in the that that we know of at least. Through AMC support, we're meeting more and more, and I think these adults are the ones that are helping us really understand um, this disability more firsthand in that aspect of things. So I just think that that's very important to kind of touch upon the importance of having someone with lived experience in this research project. So, yes. And then am I in this one? I think I am. Yes. Sorry, I forgot. Um,
You can share if you want, Luca.
yeah, no, it just I think just going back, the idea is what's really important, I think, about our co-development model right now is the fact that it is really including everyone on board. And the idea is just the transparency and helping out with language. One thing, as a family, let's say for me, I was born with arthrogryposis, so I'm familiar with a lot of the language, but a family who doesn't have a child with a disability and then their child is born and they have a disability, there's going to be all this stuff that's going to be thrown at them. And it's going to be language that for a clinician or a researcher or um, um, a doctor or something like that, they're going to be used to using certain types of languages that we're not used to. And ideally, we're trying to find that common goal and just be able to share the concerns on both ends. So essentially, that's what this co-design project is. And I think it's important that we recognize that the clinicians bring in evidence from past experiences, but essentially we need to make sure that trust can be put on both ends of the um, both sides. So yes, thank you. I'll
Thank
pass
you,
it on to
Luca.
Craig.
Yeah.
Yeah, thanks. So we're going next couple of slides, this section, going to talk a little bit about multidisciplinary teams and lived experiences. I think this in this audience, it won't be lost on people the value of working in multidisciplinary teams. We're very fortunate in Canada. I think we sometimes don't realize how fortunate we are to have well-developed and well-supportive multidisciplinary teams certainly across many of our neuromuscular centers, pediatric neuromuscular centers, increasingly in adult neuromuscular centers, and other rehab centers. That's a sort of a nice thing about working in Canada. That core, principle, we really value that and work towards building those teams. And AMC is really, again, a model for multidisciplinary teams. We know that there's so many impacts of AMC on multiple domains of health and development and daily living. Obviously, it's a condition where the care needs evolve across the lifespan and differ even within the healthcare setting versus the community versus the home setting. So in different aspects of daily life, there are different needs and different elements that need to be met. And of course, no single discipline can fully address those complex needs. Even the diagnostic journey and the diagnostic applications in AMC are so wide. So it really does call us to work together in these multidisciplinary collaborations that then lead to more timely diagnosis, a better understanding, more comprehensive care, and improved outcomes. Next slide. And of course, Lucas touched on this in a minute. I'm going to call on him to maybe share a little bit more about how he brought his lived experience to this project in particular, or give some examples. But there clearly is a tremendous value of lived experience. We see that when we often take the time, to slow down in a busy clinic and really understand. I mean, I know myself as a clinician, those times I can think where, I've been able to really listen and hear what's going on from the patient perspective is so valuable. It just changes the whole lens. And that was really important, obviously, as you've heard in this co-development project, where, the lived experience voice brought understanding of real world problem solving, contextual decision making, the identifying unmet needs that are, that are out there that, are not visible to all interested parties all the time. So that's really important. And then ultimately making recommendations that are, that are really meaningful. Um, I don't know, Luke, if you have any other specific examples or thoughts of what you brought, your lived experience brought to the project that you can that you feel comfortable sharing.
Yeah, I mean, I would say more specifically, just an example of when I'm in the room with my daughter Luna and my wife Melissa, and the doctor is giving recommendations. Often the doctor will stay longer, or will allow us to ask more questions, and then kind of like look onto me to see what the right outcome would be, or what the right question would be. Where we've noticed that when my wife Melissa goes to the appointment without me, the doctor is very quick to kind of brush off some of Melissa's concerns. So I think that it's very important that even though I have lived experience and I can help the doctor with some of the knowledge, it's important that the doctor can also give the time to um, the caregiver, regardless of having someone with lived experience. So my goals are through our lived experience to be able to share of our experiences. That way, the clinicians or people that are making leg braces can really be patient. So Craig, like the way you mentioned that, like you do take that time. We've actually felt like in our personal experiences that like sometimes it can get a little bit rushed. And it's understandable on big days where you have lots of patients and all that type of stuff. Um, but I guess as a parent, like you want to make sure that that knowledge is being shared properly, and that the parent gets, um, I guess, the attention that they feel that they need in that aspect of things. And I might not be expressing myself properly, but I think that like through my personal experiences as a person with arthrogryposis, and through what we're currently living with our daughter Luna, we're trying to give as much knowledge that we can for this project to be able to make sure that all parents that have a child with a disability, and arthrogryposis specifically, can be able to feel that they're in good hands, and that um, that the information is out there, and that there's a team, and secondly like a second family um, of AMCers that are there to support each other essentially.
Mm.
Yeah, and that's exactly, Craig. I'm so happy that Luca shared his experience, because it's exactly, Luca, what you said, that not only your voice and that of Melissa's, but also all the other team members here who share their unique perspectives and contribute to this project. So I know that you want to share more about this, what everyone brings in here. Like you mentioned before, some people have dual expertise, which is so enriching.
Mm. Yeah, no, I appreciate your context there, Luca. And I know we've shown this slide already a few slides ago, but you wanted to just really kind of re-emphasize um, how everyone's contribution not only contributes to the content uh, development and the contextual development of recommendations, but also informs how knowledge mobilization, and we're going to move into that section, next. Naomi's going to talk about this, but how that co-development and unique perspectives from patients and families. And here also, I really do want to point out the role of patient support and advocacy organizations. I mean, we're here tonight with Muscular Dystrophy Canada support, and what an incredible organization that is. And for many with rare conditions, finding a patient support group, makes a tremendous difference. And many of those groups are contributing incredibly to knowledge mobilization, to awareness, to sightlines into rare disease concepts, advocacy, patient registries that are moving things forward. So that is really critical in our area. Our researchers we talked about, but they're trainees too. The people that our graduate students that work with us, our researchers who are always full of wonder and pushing us forward and aren't scared to ask those questions that open up new doors and of course our clinician partners. And again, we've mentioned many names here. I'm going to take the liberty of just pointing out Salamena Schlegus, Dr. Legus, who's my partner here in London in the Neuromuscular Clinic, and a great part of our team, has opened up a whole new world for us here in terms of the global impact of disability, so connected to the global community. So, all these things bring richness to our knowledge mobilization and help us understand what media and what modalities we need to share the message in. And Naomi's going to show you some of those examples now.
Yeah, thank you so much, Craig. And I think that it's great that you point out that some of our team members represent this very global, they bring this global expertise, and we do have a very diverse team. And I just want to add that two of our team members, so Ani and Carolina, are both leaders, and they've worked a lot on advocacy and actually co-created or founded patient organization support groups for arthrogryposis. Annie for North America, and Carolina for Spain with another partner, Victoria. So these are tremendous opportunities for networking and learning together and sharing this knowledge. So moving on to e-learning co-development. So, as Luca explained what co development means, and Craig really showed the importance of working together as a multidisciplinary team with the voices of people with lived experience, really what I want to walk you through now is why e learning is important and how we integrated e learning in this project to really, again, share and mobilize the knowledge that we've developed together. So, e learning is really a powerful tool because it allows us to reach diverse audiences across locations, across borders. It's also flexible, scalable, and can integrate different formats. So, e learning can include videos, case studies, and narratives. And we'll show you some examples in a few minutes. And these are particularly valuable for rare conditions because they really show the richness and the lived experience in real world settings. So, of course, this is important in arthrogryposis because, again, expertise may be limited in rare diseases. So, again, I think that this is a great example to show today through this webinar how we used arthrogryposis as an example here to showcase that. And through this team, the feedback that we received over the past 8 months. So we started this project together back in September, and really our team members shared with us what effective e-learning means to them. So everyone shared feedback, and really the messages that we got were that e-learning should be clear, it should be concise, accessible. So we were told which fonts to use, to consider color blindness, for example, and different types of accessibilities. It should also be engaging to learners. And for example, the use of stories or case-based learning. And importantly, it should be used to allow learners to build understanding progressively. So walk the learners through in gradual incremental parts. And so, really, what's important is that high quality resources combine not only the evidence from the literature, from the research, which I do a lot of, but really, as importantly, if not more importantly, is the lived experience, as Craig and Luca really shared. And together, we can create a deeper and more applicable understanding of the rehabilitation recommendations that we used in this example. So, this is really what we want to achieve together through this project. So I'm going to move now to the next slide. And really, what we did here is that accessibility was critical in this project. So, what we did is we met monthly, and we still do. We have our monthly meeting next week, actually, with this wonderful team that you saw through Luca and Craig's slides. And we talk about what accessibility means and also what the e learning platform should look like. And so, really, this included plain language, clear visuals, providing captions and transcripts, engagement strategies such as case scenarios and lived experience narratives, also so important. And they can make the content much more relatable to the learners. And so, in AMC, in arthrogryposis, what we found in our e learning resources are that we really focused on function and participation. So, showing what people can do, the hope, the future, and also the lived experiences. So, including those perspectives throughout from the start to the end. These resources are intentionally designed for clinicians as well as families and the AMC community, so adults with arthrogryposis and youth, to support a shared understanding. So now my colleague is going to share what the impact of co-development can be.
Thank you, Naomi. So co-development, it really does strengthen relationships between clinicians and families. It builds trust and leads to more relevant care decisions. It also improves how knowledge is translated into practice. The idea is really to be able to create a shared language. We want to be able to recognize the expertise of clinicians, but also people with lived experiences. We want to make sure that we can set goals collaboratively, and we want to ultimately improve understanding for the best care possible. So, when we're talking about applying the approach, the four main models are the clinical care, um, making sure that we can share the decision making, that it's not all up to just one person, but it's something that is done together. The education is co-designed by the team that we've introduced you to. The research and is important to make sure that we involve patients throughout the research, and the advocacy to ensure that we're all on the same page. These principles can be applied in many contexts, and the key is really to involve partners in a meaningful way, and making sure that we include everyone early on in the process. So, through all successes, there's challenges, but there's solutions to all challenges. Some practical strategies include engaging partners early on, creating ongoing feedback loops, and valuing experiential knowledge alongside clinical expertise. Accessibility should really be built into the communication. So we make sure, as Noemi mentioned, that every month we do meet up, and we want to ensure that we can include all different aspects to ensure that everyone has access to this knowledge. And essentially, one of the ways that we really do this is also by creating subgroups and so even though we have our monthly meetings as a larger group, some of our subgroups meet more often as well too.
And that's exactly what we did here. So, as Luca, you shared, we have subgroups, and then each of these subgroups identify together a different type of strategy. So, what I want to walk you through now is some examples of these strategies, which include the e learning modules that you've heard about, a podcast that Luca and Francis, one of our other patient partners, who was a former patient of ours here at the Shriners and who now works as an orthotist in an adult rehabilitation center in Montreal. We are also providing presentations. So Craig introduced you to Sela Menesh. She will be co-presenting at the American Academy of Cerebral Palsy and Disability Medicine and Childhood Disability in the fall in Philadelphia with some of our trainees, Nitika and Sarah, as well as with Luca. So this is, again, exciting opportunities to share this knowledge in different platforms and events. And we have a family group that co-created a coloring book and as well some infographics. So I'm going to walk you through a few of these examples. So really the way that the e-learning modules are organized is through 8 modules, which really target our priorities and our recommendations. So through the e-learning modules, we really have animated videos, which I'll share. And so I'm just going to go here. And so everything was created through Canva. And again, our trainees worked very hard. Eden and my colleague, who really coordinates this team. All her
Naomi, you're getting a little choppy as you try to share the video. I don't know if you want to stop your picture video for a minute. Might help the band.
There we go.
Oh, now maybe better. Maybe okay.
Can you hear that? Could you hear the module?
No, we can't hear it.
Not hearing the module, no.
No, I'm gonna play it again because I'm hoping that it. Can you see it?
We can see it, yeah.
Yeah. Okay, let me
And
try again and
you're
hope.
clear now too. You're not choppy. So
Okay. Let's hope we can hear it now. I'm gonna play it again. Please let me know because I can't see any of you. Okay. I'm gonna pause. Could you hear that?
no, we can see the the early intervention come up, but we didn't hear any sound.
Okay. Okay, so I'm not going to exit the program, but what I really want to show you here is that, of course, there is an audio. I apologize for the technical issues. And what we see here is each recommendation is walked through, and the information is really provided incrementally. And so we have from the early intervention and really walking through the learner to what to do and contraindications, for example. So different considerations, what to do for upper limbs, for the spine, for the lower limbs as well. And then this links us um, to our clinician modules. So really the way that the e-learning modules will take place is that we have, again, we'll have short modules. So none of them will exceed 6-7 minutes to make sure that it's feasible for everyone to and keep it engaging. And so we have this mix of animation with the content as well as experts that that could be either clinicians or people with lived experience or people with dual expertise. So, for example, for our orthotics module, which is really cool, is that our speaker is Francis, who is also our partner here on this project, who contributes both his lived experience as well as his clinical expertise. So I'm hoping that the sound here works, but now I'm having doubts because I'm pretty sure that at the beginning I clicked what I was supposed to. So I really do apologize. But I'm going to try this just to show you what one example of our clinician modules looks like. Did anyone hear that? Or it's not working, the volume?
No, it doesn't seem like it's working.
Unfortunately, the sound's not coming through.
Oh, okay. Okay,
Is
my
it
apologies.
possible?
So I'll just
Is
spend a minute here and then
sorry.
so really what this clinician
Noemi, I was wondering if you stop sharing and then you start sharing again. if you,
Mm-hmm.
if you
Well,
because you're still
yeah.
sharing right now.
Yes. So I think, Marie-Hélène, what I'm going to do is come back to the presentation and finish up. But I want to make sure, we really wanted to make sure that we have time for questions
Oh,
at the end.
sure. Yeah.
Yeah, I really do apologize for the technical difficulty.
No, that's
But really the thank you for the option. I appreciate it. But really what the message is here that the e-learning are really engaging and showcase a variety of different perspectives to really make make the learner engage and share that knowledge. So a few other examples that were co-developed are coloring books, and each page is really a key message from the recommendation. So one example is start stretching early to help your body move. And we're working with our team to make the images even more representative of the arthrogryposis community. And we have an amazing podcast that two of our partners, so Luca and Francis, filmed together with some of our trainees as well, and my postdoc Clarisse. So they worked super hard. Arjun and Itika, I'm really grateful for their contributions. So we have an English and a French podcast. And I'm going to skip over showing an excerpt just for time reasons of time, but also I'm afraid that the sound is not really working properly. But the goal here is to share awareness. What is arthrogryposis and why should we be attuned to working together and being attuned to rehabilitation recommendations, how we can integrate that in our daily life. So that was really the goal of this podcast. So for the key takeaways, really what's important to summarize is that co-development improves trust and relevance, as I'm sure that you've heard from Craig and Luca, and that multidisciplinary collaboration, including lived experience, strengthens knowledge, and well-designed e-learning can really make the knowledge accessible and impactful across contexts. So we really want to thank you all, and like you mentioned, Craig, this association, so Muscular Dystrophy Canada, we're grateful, Marie-Hélène, for you and our different patient partners, team members. The team is very big, so we are grateful to all of you for working together and for listening today. And now we'll be happy to take questions and discussion.
So we have a question for Luca. Luca, if you had one advice to give to healthcare providers in order to better assess patients with rare conditions, what would it be?
Thank you. Um, I think that from experience, I think take your time with the patient, listen, and understand that the patient might be asking a question that might seem irrelevant, but that probably means also they don't fully understand. And so maybe sometimes for the healthcare practitioner, um, to find a way to maybe explain things a little bit differently to make it easier for the family to understand or for the patient to be able to understand. Um, and also, I'd say to be open to suggestions and advice for someone who has like lived experience. If I'm giving an example right now, with me personally, I think that there's certain types of there's a fine line between um, correcting someone's posture, for example, versus quality of life. And so I think that there's that sensitivity of that the professional has to understand that there's the social aspect and the confidence building for the patient that they need to attain as well for their day-to-day living versus the like over exercising or over like prescribing certain things. So I think that there's just like a sensitivity to that fine balance of like making sure that like ultimately, what I would say is you would want your patient to have enough confidence to be able to live their full life, as well as assisting them throughout that process and improving it, but knowing that it doesn't have to be always technical on the medical aspect of things. I don't know if that makes sense what I just tried to explain. Um,
Yeah, I think so, Luca. Thank you. I don't see any other question, but you can type in the chat or in the Q&R section your questions. I have a comment. Great project. Congratulations.
We
So,
also had Marie-Hélène some questions for the discussion at the end, so kind of a little bit food for thought. So maybe I can just share that and see if the attendees would like to, comment or that or share. So the team came up with a few. Let me.
oh, I have maybe, Noemi, between the time you are sharing, there's a quick question. What is the end goal of, well, maybe not a quick question, but what is the end goal of this project? You're on mute, Noemi.
I think Noemi
Can
is.
you stop sharing?
Yeah.
I think what happens when I share and I authorize the sound, it mutes my microphone automatically. I
Oh,
think I
yeah.
understood what happened. So it's either you hear me or the video, which at times it's hard to decide what to put. But all jokes aside, yeah, I'm happy to answer the question. And Craig and Luca, I'd love for you to add on. The end goal really is, we spent several years co-developing rehabilitation recommendations. What we wanted to do and what we want to do with this team is to co-develop strategies to first create awareness about these recommendations, but also to share them in different formats that are accessible. So I would say that our end goal is really to make sure that these strategies have created more knowledge around these recommendations. I think that hoping that these recommendations are integrated in practice is perhaps a little bit of a stretch. We would need to, really design a research study that has a specific design to implement and measure, for example, reach and maintenance and uptake and implementation outcomes. So this is not the goal of this project. This particular project is really to put a team together and make sure that everyone feels that they can contribute freely. Like Luca and Craig said, the notions of trust and belonging to this team and having their voices heard, and really, contributing to how can we create a bit more awareness and around not only arthrogryposis, but also, of course, these rehabilitation recommendations. So the coloring book is a great example, the e-learning modules, the podcast, and all these other strategies. Yeah, Craig and Luca, if you'd like to add.
Yeah, I mean, I think you touched on this a little bit, but making sure that these messages and recommendations reach a wide group and circle back to researchers. I think you were starting like mentioning that, Naomi, and it won't be a surprise to many of you that many of the recommendations in the rehab guidelines are unfortunately not based on really high level, what we kind of consider high level
Yeah.
clinical trials or clinical outcomes research, and that's the reality for many rare disease, right? And that's that's just the case. But the more we can capture researcher, clinicians, patients, energy and motivation to drive better research studies, so that we can understand these recommendations in even more thorough scientific ways would be a long arc goal of our wide knowledge mobilization.
Yeah. I think.
I go, Luca. Sorry.
Oh
Yeah.
no, I was just gonna say too. I think it just I don't think there's going to be necessarily an end goal in the sense that I feel like that the research is constantly evolving and growing. And I think that ideally, hopefully, someone else can kind of pick this up and take it to their next wave. And, like we focus right now a lot more on the pediatric aspect of things, but there's also a lot of research that needs to be done on the adult aspect of things. And not just for arthrogryposis, but I would say for all people that have disabilities such as muscular dystrophy or cerebral palsy, the research is very limited for once you become an adult. So I think that that's ultimately the idea is that this co-development model can be something that can be shared across all different platforms and all different other types of groups that can take it on and build with it.
Thank you, Luca. I have two questions, and I'm not sure we'll have time to do them, but are there any resources available for individuals who'd like to do an initiative like this for other rare disorders? And I will name the second question. Can you elaborate a little bit more on the functional and practical impact of having consensus recommendations on AMC?
Mm-hmm. So maybe we'll start with the first question, Marie-Hélène. So for resources on e-learning, it's a very good question. I'm afraid that I don't know of any resources available on kind of how to guide. The way we kind of learned is through colleagues that did similar initiatives in other, in other areas, and asking them to show us how they kind of built their own, also attending webinars like these where people showcase their own projects featuring different types of e-learning resources. But we're happy to share, how we've done our process. It was really trial and error. And again, Betty, who's here today, who worked a lot of time on building things in Canva. What I really want to reiterate is the strength of this team. So initially, we started our animations and our content in a software that's called Animaker. And this team told us, we don't like these animations. They're not engaging for us. They don't look real enough. We're not feeling it. And so we changed to Canva, and really based on the feedback in terms of caption and the audio and even the type of voice, making sure we have learning outcomes and key messages at the end. Our team members each wrote the key messages together. So I really want to emphasize that when we do develop resources for people or for a certain target audience, it's really crucial to involve them in that process. I'm hoping that that message is really clear, but again, happy to share what we've learned through this project. And maybe just to end with the second question, the functional and practical impact of having consensus. Yeah. So really the issue in rare diseases is the lack of knowledge. So like Craig said, and Luca as well, there's really many clinicians have never seen a child with arthrogryposis or with, let's say, Duchenne muscular dystrophy or any other, rare neuromuscular condition. And for the first time, it could be a little bit, it causes, instability or lack of confidence. So having recommendations or guidelines is really helpful it's like a starting point. What should I be looking at, really using as a guide? and to complement the article, because it's great to have publications in the literature, but sometimes it's hard to implement that in practice. And that again is the goal of these resources that we're co-developing. We're hoping that with the e-learning resources, clinicians and families and people with AMC can use that to really say, oh, this is how stretching should look at. Or if my child has pain, I should consider these different strategies, or ask my clinician about these different strategies, or psychosocial well-being. Oh, there's a team member, I can consult a social worker and ask to be seen by one, perhaps, or a psychologist. Or it's okay that I'm feeling anxious, or maybe my mood is not always uplifted. Or so I'm hoping that that's really what we reach with the recommendations, and having really some guidance. And like Craig said, there's a lack of high level evidence because AMC is rare, so we don't have trials comparing splinting or not splinting. Also, there is the standard of care, and removing that is not ethical. But really having some consensus around what we should be looking at in a condition like arthrogryposis, so we can also provide care that's equitable to these children.
Thank you. Thanks a lot to the three speakers. Thanks a lot for everybody that attended this webinar. If you have any question, please send them to research@muscle.ca. We'll make sure to redirect them to the three speakers. And have a nice evening. Thank you.
Thanks,
Thank you so
everyone.
much, everyone. Thank you,
Take care.
Marie-Hélène.
Thank you. Bye-bye.
Thanks.